None of us know when our last heartbeat is going to be, regardless of your age. So don't waste your heartbeats on people or things that aren't going to add value to your life. I'm rephrasing, but that's basically what he said. And so I wish that for all of you, that you get to continue living your life joyfully and safely, and that you have those conversations with your loved ones so that everybody feels comfortable and understands what your wishes are.
Quality of life that can outrank quantity of years on this earth. And that's something that we actually talk a lot. I've done some death cafes, which sound macabre, but it's actually understanding and embracing how we want to finish up our last chapter. We're all going to have a last chapter. It doesn't have to be this sad. We don't also have to talk about it nonstop because we really don't have any idea, regardless of our age.
Welcome to One Place Aging. Tonight we're going to talk with Jacqui Clark. She's a certified senior advisor here in San Diego, California, and I'm Valerie Upham. And tonight we're going to talk about aging in place, something that most people want to do. They don't have any plans of ever leaving their home, and they want to be as comfortable as they can for as long as they can in the comfort of their own home. So Jacqui, you know a lot about this. If you could kind of explain what you think aging in place is.
Great question to start with. Aging in place is traditionally thought of as you will age in the home of your choice. And I say of your choice because a lot of people want to age in place in the house they've lived in for decades. Some people want to age in place in a continuum care, independent living, assisted living, and other people will choose to travel living with different relatives. So it's really, the whole idea of aging in place is aging where you want to age.
Yeah, my husband and I were just speaking this week because he knew we were getting together for this. And he's going to be 60 this year. And we were talking about, well, I wonder what our life is going to look like as we age. And we have 3 children. And we talked about, well, we kind of imagined that we would be the couple that would move into an independent living situation where there's lots of activities around us and we could go down for the activities separately or together. And then when we want, we'll just go back to our apartment and live in silence and quiet, peace, just he and I enjoying each other's company. And then I started thinking about, well, that sounds great. But then I was thinking about all the friends that we're going to make and how as we age, we would probably start losing friends and how that could be sad. And Jacqui, you were talking to me earlier about how whether you're in a senior community or you're living in your home, that still happens.
Yes, we lose friends regardless of where we live. I was telling Valerie that I had a client in the last couple of years that she had planned on living at home, and she had planned it, the resources, the support system, but what she didn't plan on was that her neighbors were going to move away from her. So then she was losing her core group of people she had always been around. So then she made a decision to move into assisted living. She had a very specific heart condition where she thought about that she didn't want her children to be the ones to find her when her day came. So that was the reason why she ended up moving.
I know with my mother and my stepfather, my mother would not have been able to live at home as long as she did because she had vascular dementia, had it not been for my stepfather, because he was her caregiver. And so the two of them, they got by. She had the physical ability to get around the house, and he had knee surgeries and was, using his cane or his walker at certain times to get around, but together they took care of each other. And so I was grateful for the amount of time that they were able to stay in their home.
Yeah, I mean, my mother too coincidentally had vascular dementia for 12 years, but between her 4 kids and my dad, we were her village that were able to keep her home almost to the very, very end. Maybe the last 3 months we needed to have her in somewhere else. But it was a gift, but it was a lot of work.
So for anyone wanting to age in place and they want to stay in their current residence, or maybe they want to go from a 2-story home and downsize to a single-story home, what do they need to have in place so that they can do that?
I think the most important thing is planning, and I really believe planning should happen in your 40s and your 50s for best outcome. But it's never too late, and what you want to think about is you want to plan finances, where you want to live. You want to look at your house. Is your house a 2-story? And if it is a 2-story, you want to make sure you have a bedroom and a bathroom without a bathtub that you can continue to live in. The number one reason people have to move is due to falls, and falls happen because we have unsafe homes, specifically bathtubs, stairs, rugs, difficult doorways that aren't wide enough for walkers or wheelchairs. So if you plan to make your home livable, even when you need help with mobility, because mobility is the number one thing, again, that will force you to move a lot of times, you have a better chance of staying at home. When I talk about finances, long-term care policies, savings, ADUs have become really popular. Just have a plan of who's going to help you age in place, who's going to take care of you, because we all will need help at some point in our lives.
The thing is, I think that's hard to plan for is no one knows what their health digression is going to be, whether it's cancer or if they're going to break a hip and then their health declines after that. So there's all these different factors. And so it's hard to plan because nobody wants to imagine themselves in a situation where they're ailing, right? And so it's easier just not to think about it. But there are things that you can do that you're going to need no matter what. And the most important thing, if you get anything out of this whole presentation, is to get your power of attorney in place for your healthcare decisions and for your financial decisions. And having that in place and speaking to an attorney is the best thing that you can do for yourself and for your loved ones. So, and then one extra step beyond that is share it with your children. Some people think that, I've got the documents in line and when I'm gone, then my children can read the documents. Having that open dialogue is so important. So when you pass, your children are grieving, and the last thing they want to try to do is to understand what's in those documents. So having that open dialogue is very, very important.
Right. I'd like to add too that when you share with your family your wants and your hopes, you make it more possible because your family knows what you want. But at the same time, if you ask your family, promise me you'll never move me out of my home, that's not always a promise that family members can keep, because there are illnesses that just prevent us from staying in our homes. And we never know, even the specific diagnosis, we never know what direction it's going to take. So when you let your family off the hook of these promises that it's just heart-wrenching for them to have to make. I mean, they show up on my door with a diagnosis of their parents that, I promised my mom I would never move her, but then it's impossible to keep her home, and they just feel like they have broken their word, but it's a word that they never should have had to make that word in the first place. So I asked family members that you make your plan with realistic views, from finances to just staying at home. Staying at home is probably the hot button. Everybody wants to stay home. But again, as Valerie said, sometimes you can stay home by downsizing. A better home that's more walkable community, closer to your family members, or a less expensive neighborhood. There's many options, and that's why you need a village to help you age in place.
Absolutely. My father moved from Iowa to San Diego to be near me and my children, his grandchildren, and he never wanted to be a burden on me, which nobody wants to be a burden on anyone, right? But I was so grateful that we had those years with him, because had he been in Iowa and then had gotten sick while he was at that distance from me, I would have been so worried and so stressed and always feeling like I should have been there. So if you're considering moving to be near your children and you're worried about being a burden, it's actually harder, I think, from my opinion, to be far away from your children, and because then they can feel helpless and like they can't help you. So I think that's something to consider, to be open to considering.
I have 3 families that I'm moving from out of state to San Diego area to be closer to their adult children. And the adult children are actually not only relieved, but they're excited. They want to be near their parents as long as they can. It is incredibly hard to give up your entire life when you've lived in another state or another part of the United States or in California. But I think when you have a realistic view, when there's nothing going wrong with you, you can better make those decisions. I'm constantly telling my children that this is what I want, no matter what I say later on. I'm telling you right now, when I have sound mind and a distance from being in the moment of it, that this is what I want you to do. And if you don't want to put a burden on your children, don't have them promise unattainable expectations of aging.
I will say that if you're going to move near your children, if you have the choice to do it while you're healthy, because when you have children, you have to change their diapers. It's not all beautiful, right? But you have all this joy that comes from it. So there are sacrifices that are being made, but there's joy. And so my dad moved out here while I could still enjoy him, while the children could enjoy their grandpa. And so when it did get hard, we had those joyous memories to cushion the sacrifices, and the sacrifices were worth it.
Well said, yeah.
So what are some small things that people can do in their home? Like maybe you have a story, or maybe just a scenario where you've walked into a home, and I've done this many times, and you see all of the dangers in the home. What would you consider are dangers in the home that people may not realize?
Well, the number one thing I would say is always loose rugs and stairs. And what people don't consider that can be installed quite easily is a stair lift. And I know it makes people feel like, oh, well, I'm old, or, well, guess what? We are getting older. And a responsible adult will say, I don't want to fall down the steps. And so adding a stair lift, widening your bathrooms on the ground floor. If you have an unusual entryway, which is a tripping hazard, or for whatever reason, if you have mobility issues that it is a fall risk for you, then make changes, and pride gets in the way of us aging more gracefully. The number one thing that will cause you to lose choices is falling. So don't fall.
And I see a lot of mostly men who won't use a walker, or they don't want to pull out the cane because of pride. And that is creating a bigger risk that,
Oh, I have a lot of women. Women, I think, plenty of women. We got my dad a really cool cane when the first time he stepped off the bus and he missed the step and he fell, and we said, well, you got lucky this time. Are you going to take the chances? So we sent him like a really cool cane that folded up to like just like a stick, that it just made it look a little bit cooler. And he's like, all right, I'll use it. And then he was fine. He never fell again. So that was great,
Yeah. I have a woman in my neighborhood. She has a 2-story home. Actually, it's a split level. And she wanted to stay in the immediate neighborhood because she has a great circle of friends surrounding her. And we went to look at this home. It was also a 2-story home, which confused me. And I talked her out of buying it because I saw all of the additional dangers of this other home. And she ended up looking into a chairlift and into an elevator. And so they built an elevator in her garage, and now she is able to stay in her home. And she's so happy and just delighted. So it cost a pretty penny for an elevator versus a chairlift. With the chairlift, but she was able to stay in her home, right? So with the chairlift, we found one online for my mom and my stepdad. And that allowed them to go down in Iowa, there's basements. So it allowed them to go down to do the laundry or hang out in their family room. And not everybody uses the chairlifts the correct way. My stepfather would put the laundry on the chair, and then he would stand on the side and he would ride it up. So I don't recommend that, but at least they eventually used it appropriately, and you can find them online, but you have to make sure that they fit the space. So there's ways to get discounts on things.
I like to add too that having a great village, and a village can consist of family members, of course, also can consist of wonderful neighbors. I think we underestimate what great neighbors we can cultivate. And I think especially as we age, and like I'm seeing it in my own neighborhood, that my neighbors are changing. Maybe the neighbors that were the older people have moved, have passed, and now I'm becoming one of the older people in the neighborhood, and younger neighbors are moving in. I need to get out there and start learning their names, seeing who they are, because in 10 or 15 years, I may be calling on them. Transportation will facilitate a move every single time. We have to figure out transportation for our aging adults. Nobody wants to rely on the bus. It's not convenient. I look forward to hopefully being one of the first generations of completely safe driverless cars. We have Uber, but it is expensive, but we do have it. And there are some other things on the horizon, but I do think transportation is a game changer of being be able to live at home.
Yeah, and Uber has special rates, so you can pay a monthly fee. I don't know if it's in every state, but I know in some states they have a discount or a monthly fee, and then so overall, it depends how much you're using them, but that's something to look into.
Well, you know, with what gas costs and registration and insurance are on cars and actually owning the cars, it really, if you start doing the math, you get a spreadsheet out and you start really figuring it out, you may come out ahead, because, you know, as we get older, we're not going everywhere like a young teenager is. So it's something to think about, something to budget with. You know, financial planning, you can't say enough about it. It's not just, you know, here's my 401k and how much is my house worth. You should also look at how much is it going to cost for transportation. Transportation will keep you independent, and it will keep you living in your home or anywhere else a lot longer, because you have to also get groceries and bringing them in. I wish we had a program to engage our high school kids, because we have this huge gap. They need more face-to-face time with humans, and I think this is the first time that we have a longer working population. Never before. No one's looking to retire at 65. We have thriving careers in our 70s and 80s. My mother-in-law just retired from law practice at 87. She's already bored. She lives in independent living. She has for about 6 years, because my father-in-law at the time needed more help, and he has since passed. But one of her reasons for moving, and she wasn't going to give up her law practice, she does taxes, and if anything, she never had more clients, because all of a sudden she had all these built-in, you know, things to do, was that she didn't want to be alone. She didn't want to be alone in her house when her husband passed, and she wanted her peer group. So that was her decision for moving, and she moved in her early 80s. But I asked her, I go, do you think you made the right decision? And she says, absolutely. I don't know I would have been able to survive the last couple of years if I hadn't had this established group of really good friends. She travels with them still. They get into trouble. You know, they're having these crazy tea parties that I think there's more wine than tea going on. But we should not retire from life, and that's good planning will keep us going strong.
So that brings us to the topic of socialization. If you are going to stay in your home, Jacqui had mentioned getting to know the new people that are moving into your neighborhood, the younger folks, so that you can establish those relationships and have your own new village, right? It doesn't just take a village to raise children. It takes a village to get through life, you know, no matter what age that you are. And socialization is a huge part of longevity. And it's not just about what you eat and your exercise. Those, of course, are very important to longevity. But having that social connection with people, and that's why I was saying that I think my husband and I will choose the independent living and not have all the housework, but we still want to be near our children. So do you have anything to say about socialization?
I mean, socialization, there can't be enough said. If you look at all the blue zones in the world, the key component is community. And community means neighbors, friends, and family. That is the number one reason. Lack of community, lack of interaction with humans is one of the biggest factors in cognitive decline. We need each other. We need people, we need engagement, and we need help. So yeah, you can't say enough about socialization.
So tell me a little bit about why you're doing what you're doing. I know one of your specialties is senior placement, right? Helping older adults look at independent living, assisted living, and different living conditions here in San Diego. That's only one component of what you do.
Right.
But you're a certified senior advisor.
I am.
And you're a consultant.
I am a senior care consultant, yes.
Tell me a little bit, why did you get into this? What's your story?
Well, almost 12 years ago, my mother was midway through a 12-year battle with vascular dementia. And my dad also was diagnosed with terminal cancer, which he beat. And I was just ready to do something different. And this sort of fell into me. I never knew anything about senior care. I'm specifically what they call a placement agent. I help families find assisted living, independent living, in-home care, memory care, and then residential care home. And I went through dementia training so I could, this was for my mom. I wanted to understand how to care for her, how to redirect, how to be. And I also realized while our intention was to keep our mother home, not everybody has that option for whatever reason. And I wanted to make sure that every family had all the best resources they needed to make a good decision. I don't make the decisions for them. I give them the best options, the resources. And I also discovered that this wasn't geography we were doing. I did deep dives in each community. I learned about their care violations, their amenities, their costs, I learned how to understand pricing, rules, regulations in the state of California. And then also I realized I needed a good Medicare expert. I needed a good financial planner. I needed attorneys, conservatorships, realtors, because that's the number one way I think right now people are funding their assisted living and memory care is selling their home. It's the biggest asset for most people in California. Not all, but some people. Some people have been smart and have, two homes, and so they sell one to pay for their care. Everyone has a different situation, but I just wanted families to have the best resources that they could trust, because there's so much elder abuse and fraud, which could be an entire episode, by the way. I saw how my parents benefited from me learning about all the intricacies of aging, that I wanted to share it with everybody going forward.
Yeah. I've been a real estate agent for over 20 years, and I'm a seniors real estate specialist, as you can tell. And early on in my career, this became important to me because I was watching my parents get older, and I started worrying about their future. And I have a daughter now who's 22, and I asked her last week, because this is topics in our household often. I said, do you worry about me? Like, what's on your mind? And she said she worries about my mobility. She worries about that. She said, I worry about that a lot, which really surprised me. And so when I was in my 30s, that's when I started worrying about my parents, because they didn't have a lot of money and I didn't know how they were going to pay for things. And then I started thinking about, well, I'm raising my own family, and then I'm just trying to raise my own family and get through my own life. How is this going to be my responsibility now to take care of my parents? Because I love them and I don't want them to suffer. And so one of the things through the years, I started seeing more and more people have a trust in place, and for their home, rather than selling and being stuck and going through probate, they had a trust. And I saw the easier path from having that trust in place. And then I started talking to my parents, and I said, Mom, I really think it's important for you to get a trust. And she said to me, she was 70 at the time, she said, well, I'm not dying tomorrow. And I said, I know. That's exactly why I want to have this conversation today, while it's not emotional. I mean, of course, there's still emotion tied to it, but we're not in a crisis situation. And that's really the time you want to start having those conversations, because you can say the what ifs and not have as many tears between you in that conversation. And that's really what got me wanting to help more people, and to take the equity from their home, help them improve their house so that they can have more equity to pay for their care, or even to leave a legacy. So that's why it's important to me.
It's a very complex issue, because it's one size fits one. Everyone has a different situation. Even what we want is different. And I have found that aging sneaks up on us, but also Diseases that you didn't think were going to be anywhere in your family can just pop up randomly. And I always thought my mother would be the 99-year-old grandmother, and she wasn't, through just some fluke 3 head injuries she had at 20, 40, and 60 created a vascular dementia, which is a very common thing with multiple head injuries. There was no dementia in my family. There was none in any direction. So it wasn't something we ever planned. And for so many years, we just didn't really embrace it because we're like, this can't be happening. She's way too young.
So what kinds of things did you do when you started seeing signs that your mom had dementia? Like, did you have conversations with her? Did you bring it to her attention? Did you go to the doctor?
So here's the thing that we see a lot. My mom was the classic case. She was in denial, and till the day she passed, she was never going to admit she had this. And it really wasn't, like, we knew she had it, and when she went in, her license got pulled because her driving was getting really poor. She lost her central vision, she only had her central vision. She didn't have her peripheral very well, and she also couldn't see like a black purse on a black countertop or something, and her spatial was really off. She had no depth perception. She was, for whatever reason. And so when that happened, she had to go get a cognitive test. We knew that was happening, which forced it. And interesting enough, she told the doctors that we were never to know anything. So she kind of locked us out on it, even though we knew it was happening. And so what my sisters and I finally decided was, I do believe this. We all get to live and age and die on our own terms. And she wanted to do it her way with no medications, and just, luckily she had a very docile case, shall we say. She didn't act out. She didn't wander. She was very easy. She was mobile until 3 months before she passed. So that was an advantage for our family. But there was a lot of turmoil in terms of how do we take care of our mother, and because she didn't ever want to admit it. And so, and honest to God, until the day I saw that death certificate where it listed Alzheimer's, I almost doubted myself some days, even though I knew it was there. So, and then we found out later it was vascular. We found paperwork. We saw it. She had kept it. And this is a common journey that I get clients saying, well, my parents are in denial, my sister's in denial, whatever. And that does make it harder. But I always say, you can deny and you can refuse. But at some point, if you don't make a decision, the decision will get made for you for your care somehow. It's just the way it is. You can't stop the train.
Hi, friends. I want to pause here and speak directly to the sons and daughters listening. If your parents' health is changing, if the house isn't supporting them the way it used to, or if you're stepping into decisions you never expected to be making, you may be trying to figure out who should be helping you right now. Well, there's a lot of voices in this space. The key is knowing which one actually fits your situation, and that's where a discovery call can help. During that conversation, we look at your specific circumstances and get clear on what needs attention first. It's about helping you identify the right next step and the right professional for your situation, so you're not guessing or reacting or carrying the weight by yourself. If having that kind of clarity would steady things for you, you'll find the booking link in the show notes. Now, back to the episode. As you're talking, I'm listening and I'm thinking about, well, changes do happen, and sometimes suddenly. And people then go to their doctor, they go to the hospital, whatever the circumstance may be, and then they expect that their Medicare is going to pay for their care. Right. And it doesn't. It pays for maybe a short-term rehabilitation period of time, but otherwise
it's all on you. Yeah. I think that's one of the hardest things for people to understand, is that Medicare covers medical expenses. And yes, dementia is a disease, but think of it like a pregnancy. They pay for visits and delivery, but they don't pay for you the 9 months that you're pregnant and you need vitamins and extra care. So that's the same way with all our aging. It's called custodial care, the activities of daily living, bathing, dressing, showering, incontinence care, wound care, feeding, anything along those lines, mobility issues, it's on you. So, and that's sort of a shock to people. You break your hip and you need rehab, you get that, of course. But everything else, it's our dime.
Yeah, I've never heard the 9-month scenario from
Yeah,
the delivery and the...
Right. It's a good way to understand custodial care, you know.
So I mentioned that my mom had dementia. They would call me, I'd be in California, and they'd say that she was trying to leave the house. So I said, hide her shoes. She's not going to leave the house without her shoes. And so we did that, and that helped us. It helped the family a lot, worry less. And I remember years ago, I went to a class about dementia, and this is before my mom had dementia. And they were talking about how to have conversations with somebody with dementia. And one thing you don't want to say to the person with dementia is, oh, you're not going to remember this later, because you might think, well, I'm going to have this conversation and they're going to forget it later. But you don't say that because in the moment, they're there. And also, do you remember me? Or you remember, like keep bringing up that they remember. It might make you feel good, but just be aware that I imagine if I had dementia and someone said that to me, like, do you remember? Oh, you remember, don't you? And I didn't, I might feel bad. And I don't think that people have the intention of making someone feel bad, of course. But those are two things. But what I learned at that class was just sometimes you have to tell little white lies, correcting somebody, you don't have to be right. Like if over small little things, it's okay to tell white lies. They think that they need to get up and go to work. And the example that was given was perfect because my mother was a school teacher. The example was, well, Mom, it's Saturday. You don't go to work on Saturday. And that can be with anybody. You can tell them, oh, it's a holiday. You don't have to go to work today. And the person with dementia, you're redirecting. You're just constantly redirecting. And when they're repeating stories, you just redirect and try to get them onto another spin on the record.
Very
right?
Good. Yes, definitely.
So
I'd like to add that, we're talking about a lot of aging with illness and disease, but there's also a ridiculous amount of amazing aging where I have this cute little couple, 96 and 92. They finally think they're ready for assisted living. They've been living on their own. They're amazing. They're sharp. They have a little bit mobility issues. The stairs are starting to get to them, so they are moving. But there's many people that age beautifully, and we increase our chances of that by, and it's never too late, eating well, exercising, socializing, and seeing our doctor, following, just good health practices. And we can do it. We can all age better when we have the great information. I will tell you right now, financial planning is so key to healthy aging because it gives you more options for just the luxuries, the luxuries of aging, from transportation to better food, to better care, to better doctors, and et cetera, et cetera, et cetera. So, I always tell, especially my 40 and 50-year-olds, that you have a unique time in your life that you can still make a lot of great decisions. But that's not to say that I don't have 40 and 50-year-olds that are going through things that we have to address. So there's lots of great aging. I get many 100-year-olds, and my first question is, what'd you do? Inevitably, they're always like, in my 50s, I did, and it's usually
tell us.
Hard things like they stopped eating sugar, and I was like, what? But it was usually moderation, good exercise, some drinks, some don't, nobody over drinks, but they all have their own little plan. But I would say what I always see as a pattern is they kept their brains working. They were engaged in business or hobby or family, or volunteering is unbelievable. Yeah. Music, things along those lines, just wonderful things to keep us aging beautifully. I always say living well, not just aging well,
Mm-hmm. There's a lot of information out there. There's books on longevity, Audible books if you don't like to read a physical book. And there's so much more information that's coming out. And you mentioned the Blue Zones. There was a documentary, I think it was on Netflix.
It was really good too, yeah.
There's 4 different areas or 4 different episodes, and they focused on those different areas in the world. And they did have the community. Community was key. And then they were using their hands a lot. So like gardening, using your hands, and not on phones, but, physically exercising them, in joyous activities. And then this diet And then there was, what was the fourth one?
Oh, it was mobility, exercise,
yes,
yeah.
up and
yeah.
down the
Outside,
hills.
being outside.
Like in Italy, those steep hills, they would walk to the grocery store, and we get so used to our conveniences nowadays. It's like you need to push yourself a little bit and be active. Yeah. So I appreciate that you brought up that people can live and age well.
Yes, definitely.
I think that's really important, and that is the focus of like what can you do to age in place in your home and have a happier, healthier life. Adult children of parents, they may see their parents aging. Well, obviously they are. And how do they know? Because people want to keep their independence, right? Nobody wants to be told what to do. But the adult children are witnessing their parents, and then they have these worries. What would you say to the adult children in allowing their parents to have their independence?
So you want to keep them safe. If you have a parent that doesn't not have the cognitive ability to make good choices, you'll have to step in. And if you don't step in, your neighbor will, adult protective services will, so somebody will. So again, you can't stop the train. I have had people whose parents are exit seeking, getting in cars, wandering at night, dangerous things, and they weren't doing anything, and the neighbors called on them, and then in turn, that's where I was brought in. But the other thing is, if they're safe and they don't want to move to assisted living and they don't need to, I don't push. And if they don't want treatment for certain diseases, people in their 80s and 90s usually don't want treatment for cancer. It's a personal decision, and there is such a thing as quality of life that can outrank quantity of years on this earth. And that's something that we actually talk a lot. I've done some death cafes, which sound macabre, but it's actually understanding and embracing how we want to finish up our last chapter. We're all going to have a last chapter. It doesn't have to be this sad. We don't also have to talk about it nonstop, because we really don't have any idea, regardless of our age. We have a lot of young people in this room, and I hope we're not scaring them, but we don't know when our time is up, and so embracing every day as just as joyful and engaging as we can is truly the key to our happiness in living and aging well.
Well said. Thank you very much. I was just at a seminar, and Tim Grover, who was Michael Jordan's coach, and Kobe Bryant, and he was speaking to us, and he told us to put our hands on our heart, and he said, none of us know when our last heartbeat is going to be, so regardless of your age. So don't waste your heartbeats on people or things that aren't going to add value to your life. I'm rephrasing, but that's basically what he said. And so I wish that for all of you, that you get to continue living your life joyfully and safely, and that you have those conversations with your loved ones, so that everybody feels comfortable and understands what your wishes are. And I wish nothing more than happiness for you. So thank you so much for being our guest today.
It's been wonderful sharing.
Now we will open it up to questions.
Can you give us some examples of success stories of how you helped somebody identify the fact that they needed to make a change, and how you did that?
Actually, earlier this year, I had a woman call me in my neighborhood, and she said, I'm stressed because we want to move, but we love our home. We've been here for 20 years. We've raised our children here, and we're just not ready, but we know there's affordability issues and concerns. And I said, why don't you go ahead and move and then rent out your house? And that way it gives you time to live in your new life. And then meanwhile, you can rent your house until you're comfortable. And then if you decide you need to move back, then you can. And then she thanked me, and then a month later she called me and said, okay, I'm ready. And I want to write an offer on this house, and then we want to sell our home. So sometimes, even as, in any situation, you need to give people, I like to give people space to make the decision for themselves. And that's one of the most recent ways that I was able to help someone. More specifically, so when people call me, they typically do know that they already want to move, and how I help them is to go through their home and look at things that they can do to improve the value of their home. because that is likely their largest asset. And so if there's things that we can do to give them a better return on investment, I want to help them do that. And typically painting, replacing the carpet, and staging and removing the popcorn. Those are the things that are going to get you the biggest return on investment, so that you can take that money and then spend it in your new home, to pay for your care, to move to assisted living, whatever your health needs may be. Or you can leave a legacy with that money. But if you sell your home as is, and I've seen a lot of people, I'm going to reword that. I've seen situations where investors will knock on people's doors and say, I'll buy your home with cash as is, and you don't have to do anything. And that sounds very appealing to some people. And so they agree to sell their home, but they don't know that they're leaving $200,000, $300,000, $400,000 on the table, when if somebody would have talked to the right person and been guided correctly, they could have changed their carpet and painted and spent, and termite repairs and things, but maybe $40,000 or $20,000 depending on the circumstances, right? And they could have tripled or quadrupled that investment. So, and people would have paid more for the home because it's now clean and move-in ready. So it sounds burdensome. I know, I've seen people that have lived in their homes for 30 and 40 years, and all of the piles of things they have in their house, and it feels overwhelming, but there are people out there that specialize in helping you take one step at a time and decluttering your home, and having an estate sale, and just doing one step at a time so that it's not so burdensome.
And Jacqui, what you do is very interesting. How does somebody work with you, and how are you compensated?
Great question. I'm so glad you asked that. So much like a realtor, we always say, I have contracts with all the communities in San Diego County, most of them at least, and I get a percentage of the first month if somebody moves in, so it's no cost to the family. And the biggest question I get is, well, doesn't that make you, doesn't that mean that you're going to want to move me into the most expensive community and stuff? Mm-hmm. Well, no. Well, if you're ethical, no. And not to mention, they're all different contracts. I mean, sometimes something's a better commission on a less expensive. I never know. They're always different. There's a lot. There's over 700, so I can't keep track. But that's how we keep it free to families, is that the communities compensate us. And the question is, well, why? Well, because I always say, the communities have one color to sell you, pink, and I have 700 colors to sell you. Mm-hmm. And they know that since I have more options, it's a better game for them, so to speak, because it's hard for them to pay someone to go out and sell one color. When I have so many, and you say, I want chartreuse, but I really think you're a blue, Gail, and so I show you why. Your life's going to be better with blue, it matches your eyes, et cetera, et cetera, et cetera. And then you're like, I never realized that. I have walked through all the communities, I see the care violations, I constantly see the changes in staff, I know what the problems are going on, so I am not married to one specific community. Mm-hmm. Like a good restaurant, I love my restaurant analogies. You love, your Italian restaurant, and I'm bringing everybody there, and one day it's sold, the chefs changed, and the staff quit. It's not the same restaurant. And that's the same thing with assisted livings, and I keep on top of that for you. I had a client this week who needed to go to a small residential care home, and it had been a while since I'd been in this specific area, just because my clients were somewhere else. So I looked up every single care violation on the state. It took me hours, by the way, but I knew it was important because I noticed that a couple of them had been sold, one I wasn't sure of, and so they had changed the pricing structure so differently and so unfairly. I thought I wanted the client to understand that it costs this much at this place, but if we go 2 miles out of your way, she wanted to be in a certain area, we can lower the price dramatically. Now it's up to them whether they, driving 2 extra miles is going to ruin their day, and sometimes it will, because if it's the spouse who can only drive down El Camino and making a right, then it does matter. But I give them options, and I help them interpret how the pricing and the care. I have really specialized in challenging diseases, and so not all communities can handle that. So there's one license in California called the RCFE, Residential Care for the Elderly, which allows the 6-bed boarding cares, the big, large communities, and the memory cares to all offer the same services of care. But they don't have to, and they don't choose to. So they specialize. There are standalone memory cares that are really good at challenging and difficult cognitive behavior. And I'm able to, and a lot of time the communities will call me and say, hey, I have Mr. Smith that isn't a fit for our community. He's walking into the rooms, he's taking his clothes off, he's getting in fights. Can you move him? I know exactly where to take him. So that is the reason why the communities work with me, because I'm part of an ecosystem that keeps it running a lot smoother if I were not involved. It's sort of like when you were saying, you can sell your house really quick with all cash, but you may be leaving $400,000 on the table.
Right.
Yeah.
Something interesting that she and I have had a conversation about before was specifically about diabetes, and going to one facility versus another. They may look the same to a layman, and you know the difference. And so, can you explain that?
So one of the first things I always ask my clients is when we're going through like a care discovery is, are your parents or your spouse, are they diabetic? And if they say yes, I say, do they take traditional pills of metformin or do they require insulin? If they say insulin, we've just eliminated 98 or more % of all those 700 plus communities, because California, and it's different in every state, says you must have a nurse on staff 24/7, which seems like, well, aren't there not nurses everywhere? No, it's not required, and there may be nurses 12 hours or 18 hours. Well, why don't they staff 24 hours? Because nurses are at least $60 an hour to staff, and that means you need to have 3. And if you do the math on 3 nurses at $60 an hour a year, that's a tremendous expense. So if we do find a place, which we do have them, that can do insulin, you're going to easily add $1,000 to your per month charge. And one of the first things I tell families is, if your doctor says it's okay to not be on insulin, sometimes they're on it just because of ease. Sometimes they absolutely have to have it. There's no other choice. But we let the doctors know that you are causing a cost they probably don't know that is so cost prohibitive for some family. That's an extra $1,000 or more a month. And then you may be in an area where you're going to have to go 45 minutes to the other side of the county to find a place that happens. And it's quite a burden. So again, I try to get to narrow it down and let you know what places are going to be most appropriate for your care needs, your budget, and your family life.
Could you address in-home care?
Yes, in-home care. So in-home care in California you have a caregiver come into your house. It's non-medical. Everything is a non-medical model. So what does that mean? It means that technically they're not allowed to give medication, but they can help with activities of daily living, bathing, dressing, showering, and personal assistance from grooming, errands, cooking, cleaning. Some in-home care companies have nurses components where they can do a little bit more with medication management or insulin shots or wound care. Usually we bring something called home health, not to be confused with in-home care. Home health is a Medicare benefit. It's like you break your hip, you go to the hospital, you get your surgery, you go to rehab, and when you go home, a nurse visits you a couple times a week for a couple weeks. That's home health. That's short-term Medicare coverage with medical intervention. In-home care, as I said, is activities of daily living, errands, personal help. It's licensed by the state of California, and in the last, I'd say 7 years more, it has quadrupled in cost. So in 2014, when I first started, the cost of hourly in-home care was between $18 and $21. We are now at $45 to $55, depending on area, times, how difficult the case is, and what you need. And people ask why. Well, rules and regulations have changed. Workman's comp, background checks, minimum wage, training, liability coverage. There's lots of factors that go into it. So I would say half of that $45 is easily going to just costs that nobody sees, but just checking the boxes. An in-home care company once said that their profit margin was unbelievably small, even though their top line, which is all the money they make every year, seems very large. Their profit margin is can be very slim, especially if you don't have a tight ship. Caregivers are notoriously difficult to keep. They will leave for 25 cents more. I wish we could pay them a lot more than they do, but if you think about it, if they're getting paid $25 out of a $40 an hour, you can do the math on what's left over before you pay the state and your insurance.
And there's job burnout.
If they can't, they can't get to, if you're living in a part of the county that is affluent, and maybe caregivers aren't able to live there, the cost of gas is the employer sometimes has to cover it, so that's going to add to your bottom line. Why is it important to use a licensed in-home care company? It's because they're bonded, they're background checked, and there's oversight. That's for you as, you're letting somebody come into your house most of the time, and there's nobody else there. Now it's different if you have a spouse, if you have, a young adult, a grandchild who's kind of overseeing it. But when you let somebody come into your house, and I'm not saying this happens all the times, but this can happen, and we do see it happen. If, our older generations have a different trust level, and they don't always understand, you leave your personal papers out, your finances with your Social Security, your junk mail comes in with all those credit card offers. Many times we've seen people open up credit cards in somebody else's name because you can just redirect the address. Or as it comes, you're picking up the mail out of the mailbox. Or I take my camera out and click, click, click. Now I have all your personal financial. And if you don't have online, let's say banking, or you think that's going to save you. Well, if I have your Social Security and your accounts, and you don't have online banking or online accounts, you can set them up. Gmail isn't easy. People have tons of Gmails. My point being is that then we start heading down fraud. So we see a lot of fraud. We see a lot of elder abuse. We see it in mail and calls. So when you have a licensed caregiver come into your house, you're protecting yourself from that.
Can I add to that?
Yeah.
So I know that because the costs are high for in-home care, people will look on, they'll run an ad on Craigslist, or they'll meet, a friend of a friend, have them come in and be the in-home caregiver. And that is not licensed, it's not through a licensed company. And if you have them for set hours and they're on a set schedule, they can't be 1099. They have to be an employee, and you're not setting them up as an employee in this scenario, right? And so if you were to let them go, technically they can sue you. And that's just something to be aware of.
Yeah.
So like you said, it doesn't happen all the time.
No, and
you have to just be aware of your risk.
So you can run your own household employee, but you would consult, there's companies out there, and I've had families saying, we have somebody we really like, and we're going to run our own payroll. There are companies that will help you set up payroll, cover the workman's comp, make sure your home insurance if you need to have a rider, does it cover it? Because if that employee falls, hurts themselves, or anything happens, and believe it or not, sexual harassment happens all the time to caregivers, especially men with dementia. And it's not their fault. It happens to women too. It's not their fault, but that is something you need to protect your employee, which is your caregiver, from. If it's true, it's not true. Sometimes we don't know. But that is a liability that you are now taking. So it gets very complicated. And these are things that we live in a very litigious world, and we have to consider the complications of it. Does it happen all the time? No. Does it happen enough? It happens enough.
So when you are looking for an in-home care company, what do you look for? Beyond the cost, what's important, and how do you know if you're getting a good one or not?
Right. So you need to do your due diligence. Right. You should make sure they're licensed. the easiest way is to find someone like myself who works with all these resources. I'm a senior care consultant, so I vet and I make sure that they have all the right credentials. There's nothing. I like to work with CSAs. We are certified senior advisors. We've been background checked. We've taken an oath to do no harm. We can be sanctioned for anything that is nefarious against seniors. We are reporters. I'm a reporter, which means if I see something, I have to report it. I have an obligation. I have to follow HIPAA rules for when I'm dealing with their personal medical records that come through me as I place them. So I work with other Medicare experts, financial experts, real estate agents, because it's a very vulnerable population. So if you can't find someone like myself, if you have to do it on your own, because a lot, especially some of the small towns don't have as many resources, check their license, Google reviews, read them, see what they're saying, Yelp, ask to talk to some of their past clients that they've worked with. Ask a neighbor who they've used sometimes. But at the same time, if your neighbor used someone 3 months ago, it's probably accurate. If they've used someone 3 years ago, it could have been sold. I had a new client this week and said, I need to move my mom to a small residential care home. I said, no problem. Well, my neighbor said her mom went to this place in Vista. What do you think of it? And she goes, I called, but I got a weird number. And I go, that place was sold 7 years ago. I knew the lady, it was great. It was sold 7 years ago, and then it was sold to another very unreputable company that actually just went out of business, thankfully. Yeah. But that's my whole point, is that you wouldn't take your neighbor's advice on medication. I'm taking this medication, it's really working, you should give it a go. You wouldn't do that. So I always say, find an expert. We use professional attorneys, obviously. We use licensed, financial planners, licensed real estate agents, use licensed professionals in the senior care industry.
Absolutely.
See if they're belonging to best practices. There are a lot of in-home care companies that have all the required licensing, and then look for the extra ones that give them the accreditation that gives you peace of mind, specifically the CSA designation, which I believe you have,
I
right?
do.
Yes.
I do. I am
Congratulations.
a certified senior advisor as well. And if you're looking for an in-home care company, are there ones that specialize in dementia specifically, or is it just across the board?
So that's a really great question, because some of them have embraced something called the Teepa Snow method, which has become quite popular. I'm not going to dive too deep into it, but it's Teepa Snow is a dementia practitioner, and she has become world famous for her amazing redirecting and methods of a kinder, gentler way with way more respect and dignity. So some companies are getting trained in the Teepa Snow method, which they would train their caregivers, which means the caregivers are learning to just have more compassion and understanding for a very challenging disease. Most of our caregivers are between the ages of 20 and 35. They're young. And, I remember what I was like at that age. I don't think I had that much compassion for seniors, and why? And we shouldn't expect them to. Their brains aren't even fully formed till 25, but yet we're putting them in charge of some of the most vulnerable population. They need good training. They deserve good training. So look for something like that. There's other dementia training that's available, and that's a really great indicator of who's doing a great job out there. Some of them have nursing components on them, which I love, because if you have feeding tubes, if you have catheters, colostomy bags, or just challenging medical devices, having a nursing component on the in-home care company can be maybe an important thing for you. If you just need some really simple care, like I need a companion, I need someone to run errands, make sure my mom cooks safely, we have those companies as well. And that's one of the reasons why when people come to me, I'm like, tell me about your loved one. What are you looking for? Let me get you to the right place. Because a lot of times the real simple in-home care is a lot cheaper. We can find, there's a few companies out there that specialize in 4 hours a day or keeping it more affordable. because one of the really neat things that some in-home care companies are doing is they're having 3 levels of caregiver. I graduated from high school and I was trained. I have a degree, and maybe I had a degree in geriatrics or social work. They're going to cost you a little more. And then I have my caregiver who has maybe background in nursing, and this is their calling. So you can have 3 levels at some in-home care companies, but with I think over 600 is what it is. How are you going to find it? It's a needle in a haystack, you know?
Did you have any other questions?
I just was going to ask you, Valerie, you said that you relocated your dad to San Diego. What type of housing was he in? Was he really close to you, like geographically, and how was that financed?
It took him 3.5 years to go through every single piece of paper in his house. So it took him that long to move. So my sister and I had to be very patient and help him. We got a pod and we filled the pod. They delivered it to his house, and I think we had about 3 to 7 days to fill it. And then they came and they picked it up and they delivered it to my driveway. And then I had about 3 days to unload it. And he lived with us. So he was with us for almost 2 years. And it wasn't until, once he was exhausted when he got to San Diego. And it wasn't until he got here that I said, let's go establish your new doctor relationship. And then that's when we found out he had lung cancer. So I don't think he would have moved to San Diego had he known before he came here. And I'm so glad that he didn't. I wish he would have known sooner. Don't get me wrong, but I'm glad he still moved out. And he ended up being, we set him up to, basically because he sold his house. He sold his house, and that's how he paid for any of his needs while he was living with us, yes. Also with my mother, this is something that may help you. I bought an Echo Show. A lot of you might be familiar with Alexa. And Alexa plays music, and you can talk to Alexa. There's also a device that's also made by Echo called Echo Show, and it's a little camera screen. And so we had one in my mother's nursing home. She was in memory care and assisted living, technically. And we had one in her room and one in my home, and I could drop in at any time, and I was able to see how she was doing. So technology has come a long way, and that has really helped us to stay connected. And so if you want to have that relationship with your grandchildren or with your family that are across different state lines, that's a great way to keep in touch or to be able to have eyes on a situation.
I love our advances in technology. I once had a lady with MS, and it was a very tough case, and she became immobilized from the neck down, and she really could only speak. And we were lucky enough to be able to, and she hated to have to wait for someone to come into the room to change the channel, you know? So we were able to, her sons were amazing. They set up all these voice activated TVs, remotes, calling them, using iPad at the time, all these really neat devices, and it just opened her world up. And I just think we have to be creative with each person and what brings them joy each day, you know?
Thank you for joining us today. We hope that you got a lot of useful information that will impact your life positively. If you would like to subscribe to our channel, please do. And we will bring you continued content around aging in your life and other senior-related topics. And for you as an adult child, if you have parents that you're concerned about, we'll even have content for you. Thank you for joining us.